Okay, in our video series on infectious medicine, in this video, we are going to talk about dengue fever. We are going to discuss that what is the presentation and diagnosis of a patient with dengue fever. We are going to discuss that how do you treat a patient with dengue in hospital and in outpatient department. First of all, dengue fever is a viral infection caused by dengue virus. Dengue virus is an RNA virus of genus Flavivirus, and it is transmitted by the mosquito Aedes aegypti mosquito. Aedes aegypti mosquito has characteristic white and black stripes over it. Now coming to the clinical presentation of dengue fever. Dengue fever is usually divided into four different categories: dengue without warning signs, dengue with warning signs, severe dengue, previously called as dengue hemorrhagic fever, and dengue shock syndrome. Now, not all patients go into all these phases. Majority of the patients develop dengue without warning signs and they are better after a week. But few patients who are not managed properly, or the patients who are immunocompromised and the immune system is weak, they can progress from dengue without warning signs to dengue shock syndrome. So in this video, we are going to discuss all these categories in detail. How do we divide patient into these categories based on the symptoms, as well as we will treat these patients according to these categories. Now coming to the first one, dengue without warning signs, in which the majority of patients present. In dengue without warning sign, this phase lasts for the first 7 days after the onset of symptoms. Whenever patient gets bite from Aedes aegypti mosquito, there is usually an incubation period of 4 to 10 days in which patient is not having symptoms. And after that 4 to 10 days, patient starts to develop symptoms, and those symptoms last for 7 days. That is dengue without warning signs. Patient will be complaining of high grade fever up to 40 degrees centigrade. And if the patient has two of these things, severe headache and retroorbital pain, patient would be complaining that, doctor, whenever I look on the sides, I get severe pain at the back of my eyes. And patient will be having myalgias, arthralgias, severe muscle pain, joint pain, which is called as breakbone fever. Remember, all these viral infections, they have classical myalgias associated with it. These viral infections have severe muscle pain associated with them, and other than that, patient will also be having typical joint pain associated with it. Other than that, patient can also develop a maculopapular rash, a measles like exanthem with generalized lymphadenopathy. So the patient will be having a high grade fever, and with high grade fever, patient will be having two or more of these things. That is dengue without warning signs. This is a picture showing measles like maculopapular rash which appears in dengue. Not all patients have this type of rash, but few patients can develop a measles like exanthem. And remember, the rash that appears in dengue virus is a blanching rash. Now if you see, if you place hand on the rash, the area will blanch. That is a blanching rash of dengue. Now, most of the patients of dengue virus develop dengue without warning signs, and they recover from it without developing any complications of shock and hemorrhage. So, when the patient are recovering, they usually develop a different type of rash in which you will be able to appreciate white spots and their skin will be red. That is called as island of white in the sea of red. That type of rash usually begins to appear when the patient is recovering from dengue virus, and it is also associated with pruritus. Patient will be having severe itching with it. Another thing that you would appreciate in a patient with dengue virus is positive capillary fragility test. What is positive capillary fragility test and how do you test it? What you do is that you apply a BP cuff around the patient's arm. You apply the BP cuff and you first check the blood pressure. If the blood pressure is from 120 to 80, then you take the midpoint. In between 120 and 80 is 100 mm of Hg. Then you inflate the BP cuff up to 100 mm of Hg and you keep it inflated for 5 minutes. You wait for 5 minutes. And after 5 minutes, when you take the BP cuff off, what you will see is that you will see these petechiae. these petechial hemorrhages. Within 1 inch square area, if you see 10 or more petechiae, it is indicative of a positive fragility test. Positive capillary fragility test means that the capillaries, because when you have applied pressure on the arm with BP cuff, a pressure of 100 mm of Hg, the patient will have damage of the capillaries. When the capillaries are damaged, platelets adhere to the capillaries and they stop the bleeding. But usually these dengue patients are having thrombocytopenia. When they are having thrombocytopenia, their capillaries will be leaking. Their capillaries will be leaking blood, and that will appear as petechiae on the place where you inflated the cuff for 5 minutes. So that is a positive capillary fragility test. So you apply tourniquet or a BP cuff to the arm, you inflate it to the point between diastolic and systolic pressure, you keep it inflated for 5 minutes, and after 5 minutes when you take it off, you will be able to appreciate 10 or more petechiae. That is a positive capillary fragility test and it shows thrombocytopenia. So this was all about dengue without warning signs. Now coming to dengue with warning signs, majority of the patients develop dengue without warning signs. They develop fever, they develop retroorbital pain, they develop headache, myalgias. But after 4 to 7 days, their fever subsides and they are totally okay. But some patients, as soon as their fever subsides, they develop warning signs. What are those warning signs? We are going to discuss that. But when the fever subsides, they develop warning signs. So this is a critical period. As soon as the fever subsides, critical period starts, because within that critical period, patient starts to develop warning signs and we should observe the patient in that. You should tell the patient that when you are going home and when the fever subsides, if there is any change in your health status, if you are facing any abdominal pain, any problem, you should immediately report to the hospital, because that is a period where the warning signs appear. That is a critical period. Warning signs appear after the fever subsides and occurs 3 to 7 days after symptom onset. When the patient is recovering from fever, the critical period starts, and in that critical period, patient starts to develop the warning signs. At risk population include patients with severe comorbidities, infants less than 1 year of age, any patient with a history of previous dengue infection. These are patients with high risk, and you should observe these patients as soon as their fever subsides. You should keep them under observation, that these are the patients who are susceptible to develop warning signs in the critical period. The warning signs include abdominal pain, persistent vomiting, the fever is gone, but there are new problems with the patient, enlarged liver greater than 2 centimeter, fluid leak in the third spaces. A very important point, patient starts to develop pleural effusion. You do chest x-ray, there will be pleural effusion, patient would be coughing, having difficulty breathing, ascites associated with abdominal pain. You will be able to see a rise in hematocrit level and a drop in platelet count. Why is there a rise in hematocrit level? Because there is fluid leakage into the third space. The fluid from blood vessels is moving out into the third space, resulting in pleural effusions, ascites. So the fluid is leaking out, but the RBCs are within the vessel. RBCs are within the vessels and fluid is leaking out. So there will be hyper concentration of RBCs and you will see an apparent increase in hematocrit. It shows that the fluid is leaking out in the third space. Patient will develop thrombocytopenia, gingival bleed, petechiae, epistaxis. So these are the warning signs and they usually appear in the critical period. As soon as the patient's fever subsides, patient is at risk of developing these warning signs. So this was dengue with warning signs. Now coming to severe dengue hemorrhagic fever. It usually occurs in the patient who are already infected with dengue virus, who are already patients of dengue virus. And now they got a second bite from Aedes aegypti. And this time the Aedes aegypti mosquito was containing a different serotype of dengue virus. Now the patient is infected with two different serotypes of dengue virus. That patient is highly prone to develop dengue hemorrhagic fever. This is why it's important for the dengue patients to use mosquito repellents, nets to avoid second bite. because second bite can be fatal for these patients. Dengue hemorrhagic fever occurs when the patient is reinfected with different serotype and it occurs after the fever subsides. Patients can develop a second fever spike because there is a bite from a different serotype of dengue virus. Patient can develop severe hemorrhagic manifestations. Therefore, it is called as dengue hemorrhagic fever because this time the hemorrhagic manifestations will be severe. Petechiae, ecchymosis, purpura, thrombocytopenia with platelets going down below 1 lakh. Patients can develop severe organ involvement, hepatomegaly, liver failure, change in the mental status. This time it's severe because this time it's two different serotypes of dengue virus that have infected the patient. There will be plasma leakage, and this time it will be severe. Patient will be having respiratory distress due to pleural effusion, abdominal pain due to ascites, and there will be a decrease in hematocrit. Now in this phase there is decrease in hematocrit because the patient is having severe hemorrhage, and that hemorrhage is causing loss of red blood cells. Therefore, the hematocrit would go down. So remember, whenever there is plasma leakage into third space, there will be rise in hematocrit. And whenever there is excessive bleeding, there will be a drop in hematocrit. So there will be a drop in hematocrit in dengue hemorrhagic fever because there is excessive bleeding. So this was severe dengue hemorrhagic fever. Now coming to dengue shock syndrome. In dengue shock syndrome, patients will be having severe hemorrhagic dengue, and with that severe hemorrhagic dengue, patient will be developing shock, patient will be dropping blood pressure, their vitals will be going down on the negative trend, they will not be able to maintain the blood pressure. So severe hemorrhagic dengue with shock, circulatory collapse is called as dengue shock syndrome, and it is fatal if not managed properly. Now, coming to the diagnosis of dengue virus, there are few basic tests that you can perform in dengue virus detection, but it's the timing of these tests that's more important. You can perform serologic tests, ELISA, to detect IgM antibodies. IgM antibodies against the virus are detected. But remember, whenever there is infection, it always takes some time for the immune system to produce antibodies. So patient in the initial 3-4 days, the antibodies will be negative and the patient will be having infection. You can also detect viral RNA through NAT tests. Now coming to an important test, NS1 antigen test. NS1 antigen test is basically an antigen, a known structural protein present on the dengue virus, and you detect that antigen. Now, in the time period where the antibodies have not yet appeared against this antigen, when the antibody tests are negative, in the very start, you can detect this antigen. So in the very initial stage, in the first 7 days of the symptom onset, you can use NS1 antigens to detect the presence of dengue. After 3-4 days, the antibodies will also appear against this antigen, and the antibodies will be positive. IgM antibodies will be positive. So NS1 antigen test is a good test in the initial phase, even when the antibodies have not yet appeared, because it takes almost 3-4 days for the antibodies to appear against the antigen. You can detect that antigen. But remember, after 7 days, the NS1 antigen test should not be performed because body is trying to clear away that virus and sensitivity goes down. And in that period, you can use antibodies at that point because the antibodies have developed very well. Remember, if the dengue NS1 is negative, it does not rule out dengue virus infection, because as I said that after 7 days of onset of symptoms, this test is less sensitive. So in that case, you can use the antibodies. You can perform serology to detect antibodies against the virus. So this is a very good chart that shows the usability of different tests according to the days. From the day first of onset of symptoms, you can detect NS1 antigen, but after 7 days, NS1 antigen should not be used. Antibodies, IgG, IgM, they usually take almost 4 to 5 days to appear because immune system takes time to activate against the virus. And after 4 days, you can use IgM, IgG antibodies. So this is all about the tests done to diagnose dengue virus. Now coming to the treatment of dengue virus. In the treatment of dengue virus, first I'll discuss the do's, the things that you have to do, and the don'ts, the things that you do not have to do in dengue virus patient. First of all, coming to the don'ts, do not use corticosteroids. They increase the risk of GI bleeding, they cause hyperglycemia, they cause immunosuppression. Many doctors use corticosteroids to treat viral infections, but they should not be used in a patient with dengue virus. Do not give platelet transfusion for low platelet count. A very important point. They do not decrease the risk of bleeding and they may lead to fluid overload. Remember, do not use platelet transfusion for thrombocytopenia until and unless there is severe thrombocytopenia with platelet count less than 10,000 associated with severe bleeding, because studies do not show any improvement in patients' health when the thrombocytopenia is treated with platelet transfusion. So do not give platelet transfusion unless the patient is having severe thrombocytopenia less than 10,000 with severe bleeding. Do not assume that IV fluids are necessary. Remember, in this condition, there is capillary leakage into third space, and giving so much fluids when the patient do not need it leads to fluid overload, pleural effusion, and ascites. Do not give half normal saline. 0.45% normal saline should never be given to a dengue patient because it leaks into third space, resulting in fluid leakage, ascites, and pleural effusion. Now, coming to do's in dengue. Do's are the things that you have to do in a dengue patient. Do recognize the critical period. Remember, as soon as the fever subsides, there is a high risk that that patient will develop warning signs. Recognize that period. Observe the patient. Tell the patient that if he develop abdominal pain, nausea, vomiting, or abdominal swelling, severe bleeds, he must report to the hospital. Monitor fluid intake, output, vital signs, and hematocrit level. Administer colloids. If the patient is having refractory shock, you must give colloids because colloids do not leak out of the vessels, they stay within the vessels and they increase and improve the blood pressure. You should give packed red blood cells or whole blood if the patient is bleeding. If the patient is bleeding, you should try to give whole blood, packed red blood cells rather than giving platelet transfusion because platelet transfusions are of no help and they may even lead to fluid overload. Now we'll go into the stepwise treatment of each one of these. Dengue without warning signs. Patient needs fever control with paracetamol, cold sponging. Do not give aspirin or ibuprofen. It's a viral infection. Give paracetamol for fever control. Prevent dehydration and give oral fluids rather than giving simple fluids like water. You should try to give ORS solution. Try to take more fruit juices. So prevent dehydration and fever control are the main treatment in dengue without warning signs. Coming to dengue with warning signs, if the patient is developing dengue with warning sign, you should admit the patient, check the hematocrit, take the blood sample, send it for hematocrit, check the vitals, and see if the patient is having adequate oral intake or not. And if the oral fluid intake is inadequate, you should give isotonic crystalloids like normal saline, ringer lactate, and you should give it in a stepwise manner. And the stepwise manner is a step down manner in which you slowly and gradually decrease the fluid administration so that patient do not develop any fluid overload state. 5 to 7 ml per kg per hour for 1 to 2 hours, 3 to 5 ml per kg per hour for 2 to 4 hours. You can increase the rate if the vitals are worsening and you can decrease it if the patient is improving. You should shift the patient to oral fluid if the patient is improving, and you can check the fluid intake or the hydration status by checking the urine output. Catheterize the patient and monitor the unit output. In that way, you can know the hydration status of the patient. And you control the fever with paracetamol, cold sponging. You monitor the patient with these three things: hematocrit, fluid intake, urine output, and you monitor the vitals. Now coming to severe dengue hemorrhagic fever, these patients are the one who are developing severe bleeds. You must admit these patients because these patients are usually in compensated shock and they can develop severe full-blown shock and develop dengue shock syndrome. You monitor the fluid intake output, you give controlled fluids in the step down manner. You give it in the same way as we discussed earlier. And then you check the hematocrit. If the patient is bleeding, the hematocrit will be decreasing. And if the patient's hematocrit is decreasing due to bleeding, you should give whole blood or packed red blood cell, 5 to 10 ml per kg packed red blood cells or 10 to 12 ml per kg whole blood immediately. And if the hematocrit is increasing, it means that the fluid is leaking out from the vessels into the third spaces. Most likely the patient is not bleeding, but there is leakage of fluid into the third space. Therefore, the hematocrit concentration is increasing. And in that case, you have to give controlled crystallized normal saline ringer lactate 10 to 20 ml per kg bolus over 1 hour. Give fluids in a step down manner and keep monitoring the patient's hydration status, as well as look for edema in the feet. Auscultate chest for any crepitations, palpate abdomen, because there might be a fluid overload, that the fluid that you are giving is going into the third spaces. Now coming to the dengue shock syndrome. In dengue shock syndrome, patient has severe dengue with shock. In that case, you have to see that if the patient is in hypotensive shock, you have to straight away give isotonic crystallides or colloid bolus. Remember, colloids are the fluid that stay within the vessel. They do not go outside the vessel, and they give a rapid improvement in the patient with hypotension. So you can give 20 ml per kg in 15 minutes. And if the patient is improving, you continue the crystallides or colloids, preferably the colloid, and you slowly taper it off. And if the patient is showing no improvement, in that case, you need to see the hematocrit level. And in the same way, if the hematocrit is decreasing, it means the patient is bleeding and you need to transfuse blood to the patient. And if the hematocrit is increasing, it means that the fluid is leaking out from the vessels into the third spaces. Therefore, the BP is going down, and you need to give colloid in this case, because colloid will stay within the vessel and it won't leak out and will improve the blood pressure. Give colloid 10 to 20 ml per kg bolus over half to 1 hour. In summary, we talked about what is dengue virus, the different categories based on the symptoms: dengue without warning sign, capillary fragility test, dengue with warning signs, the critical period, the warning signs that patient can develop, dengue, severe dengue, dengue hemorrhagic fever, the presentation of dengue hemorrhagic fever, dengue shock syndrome, severe dengue with shock, the serological tests in which NS1 can be detected early but not after the 7th day, the graph showing these, the don'ts of dengue, the do's in dengue, the things that you have to do in dengue. Then coming to the treatment of dengue without warning signs, coming to the treatment of dengue with warning signs, treatment of severe dengue, and checking hematocrit and taking the steps accordingly, treatment of dengue shock syndrome. If you liked my video, please click on the subscribe button and check out my other videos on emergency medicine and infectious medicine. I've also made a video on the treatment of malaria. You can check out the link of those videos in the description below. Thank you very much.